Good afternoon and welcome to the Colorado Health Foundation's Enhancing Health Engagement Through Patient Portal Use Funding Opportunity webinar. My name is Beth Clemens and I'm the Events Manager here at the Foundation as well as your chairperson for today's webinar. Let's go ahead and get started with some housekeeping notes. Our webinar today is being recorded so that others who could not attend can watch the presentation later. Tomorrow you will receive a link to this recording as well as the PDF presentation that we'll go over today. We'll also post the recording and the presentation on our website at www.coloradohealth.org. In order to minimize background noise, your phones will be muted in a listen-only mode during the presentation. The final portion of our webinar is devoted to questions, so please feel free to send your questions via the chat function at any time during the presentation. You should see a chat dialog area located on the lower left-hand side of your screen where you may type and send questions. You will also see a raise hand button, which we will not be using, so you don't need to click it when asking a question. If you have any technical difficulties during the webinar, please call ReadyTalk's toll-free technical support number at 1-800-843-9166. Make sure to have your registration confirmation available. Finally, after the webinar is concluded, you will have the opportunity to give us feedback through a short survey. We ask you to take a minute and complete the survey, which helps us to improve our future presentations. And with that, I'll turn the conference over to Amy Latham, Portfolio Director, Healthcare and Health Coverage at the Colorado Health Foundation. Amy?
Thanks, Beth. And thank you all for joining us this afternoon. We are excited to have the opportunity to share some information about our recently launched patient portal funding opportunity. I'm just going to make a few brief introductory remarks, and then I'm going to turn it over to Dara Hesse for a detailed overview of the funding opportunity. And of course, as Beth mentioned, we'll have lots of time at the end for your questions. So I had the chance to scan the list of registrants before today's webinar, and I was pleased to see so many of our longtime partners on today's call. So just as a brief reminder or overview for folks, we are a statewide foundation that seeks to achieve meaningful and measurable impact in 3 outcome areas: healthy living, health coverage, and health care. Our healthy living goal is that all Colorado kids are fit and healthy. And our specific measurable goals in healthy living, our childhood obesity rate will decrease to 10%, and secondly, that children's fitness levels will meet appropriate standards. Our health coverage goal is that all Coloradans achieve stable, affordable, and adequate health coverage. Specifically, our measurable goals in health coverage are that 95% of Coloradans will have health coverage by 2023, and that by 2023 we will reduce the rate of underinsured Coloradans to 4%. Finally, in health care, our goal is that all Coloradans achieve health with support from a network of primary health care and community services. And our measurable goal here is to reduce the number of days Coloradans are kept from doing usual activities due to poor physical or mental health to 2 days per month. And again, that goal is by 2023. Our patient portal funding opportunity is aligned with our healthcare outcome area. So I'm going to go a little bit deeper on the healthcare goal and strategies. Within our healthcare outcome area, we have 3 strategies. First, we seek to support communities to prevent disease and improve population health. Second, we seek to strengthen the delivery of comprehensive, person-centered primary care. Finally, we support efforts to empower individuals and families to manage their own health. It's within this last strategy that the funding opportunity that we'll be talking about today lives. So with that, I'll turn it over to Dara for details about the funding opportunity.
Thank you, Amy. I'm excited to present our funding opportunity to you today. We've been working diligently on its development. Wrong slide. We've been working diligently on its development over the last 10 months. Patient portals represent an increasingly important innovation in support of patient engagement, patient-centered care, and effective use of healthcare services. They are secure online websites that give patients convenient, secure access to their healthcare provider services or health records. When patient portals are integrated with EHR systems, the technology has the potential to provide powerful new mechanisms for patient engagement. As Amy mentioned, the patient portal funding opportunity fits within our new individual and family engagement strategy and directly aligns with the healthcare program area focused on promoting patient access to and use of health information to improve health. We began development of this funding opportunity by conducting an environmental scan to identify promising practices associated with engaging patients and consumers through patient portals, both within Colorado and nationally. This included a literature review and interviews with national experts. We also outreached key stakeholders here in Colorado, which included safety net clinics, statewide entities, membership organizations, state governments, and others. These conversations were critical to the development of the work, and we are very appreciative of the time that was given by the individuals we spoke with. The funding opportunity recommendation was approved in August and officially opens this October. In a few slides, I will provide more information about the application process itself and what needs to be submitted in October in order to be considered for this funding opportunity. The overall goal of this funding opportunity is to increase individual and family health engagement through the use of patient portals at the clinic level. We will support efforts to fully integrate portals into safety net practices and ensure their use is maximized by patients, to foster a culture where individuals conveniently access and act on their health information to engage more fully in their health, and to improve the efficiency, quality, and access of safety net clinics. The funding opportunity builds upon the Foundation's significant investments in EHR implementations through the Healthy Connections Initiative and also complements the Federal Meaningful Use Program, which is incenting safety net providers to launch patient portals by requiring that providers provide electronic access to patient health information. Further, patient portals are also required to achieve patient-centered medical home recognition, which is being sought by many safety net practices across the state. Most importantly, as previously mentioned, it will have a direct impact on our goal of increasing individual and family engagement and improving health through patient access to and use of health information. This slide provides a visual of how the funding opportunity will be structured. The Foundation will provide support to a cohort of safety net clinics to fully integrate patient portals into their practices, maximize their use by patients and providers, and foster a culture of patient engagement through information access, availability, and ownership. This will involve contracting with a statewide portal integration partner who will provide technical assistance, coaching, and other tools to assist selected safety net clinics with planning and implementation activities tailored to their operations and unique patient populations. In addition to assistance from the statewide partner, individual safety net practices will receive grant funding for the clinic-level activities that support portal integration and patient engagement. This approach ensures that implementation support is provided to clinics in an efficient, effective, and consistent manner while still meeting their individual needs. It should be noted that the intent is not to fund actual patient portal software, but rather to create an environment where patients are empowered to access and take action on their health information, no matter the delivery platform. As previously mentioned, we will be contracting with a statewide partner to provide technical assistance, coaching, and other tools to assist selected safety net clinics with planning and implementation activities. This will include work plan and patient engagement strategy development, stakeholder buy-in including patients, technology integration, workflow and process redesign, toolkit development, marketing, enrollment and training, and long-term sustainability planning. Further, the statewide partner will lead the formation of an informal peer learning community to connect grantees and facilitate the sharing of ideas, effective and promising practices, as well as lessons learned. To be considered for For grant funding, applicants must meet the following criteria. There must be a nonprofit safety net organization that has an electronic health record system with portal functionality, whether that functionality has been turned on or not. We intend to support organizations in various stages. Some may not have launched a portal yet but are planning to, while others may have launched a patient portal but need assistance with fully integrating it into their practice and engaging patients with the tool. To be eligible, an organization must provide basic primary care services, and preference will be given to organizations that provide integrated physical and behavioral health care. Applicants must have an engaged executive sponsor and project team dedicated to the portal project. They must agree to implement at least 4 portal functionalities, 2 of which must include medical record access and secure messaging with providers. And they must commit to working with the selected statewide partner for planning and implementation activities, including participating in an informal peer learning community and developing a patient portal work plan that includes the following: a mobile access strategy, strategies to address barriers that affect patient portal utilization, for example, health and IT literacy, digital divide issues, privacy concerns, etc., a plan for incorporating the patient's voice into the project and assessing the needs, desires, and preferences of patients, and a business case to sustain the implementation over time. In a few slides, I will provide more information explaining what engagement with a statewide partner will look like. Finally, applicants are encouraged to select a prevention or health condition focus area for patient portal adoption and engagement efforts. Preference will be given to applications focused on one or more of these areas: disease prevention-related efforts or patients with diabetes, hypertension, or depression. Research shows that patient portals have the potential to improve self-care for chronic conditions and have been linked with increased use of recommended preventive services. This will enable us to maximize our impact in terms of promoting health, lowering cost, and improving care. The Foundation will award grants funding for clinic-level activities that support portal integration and patient engagement. The following are some examples of what we will consider. However, we encourage innovative approaches tailored to meet the needs of individual clinics. Personnel costs for individuals to serve as portal champions or advocates. It should be noted that this would be for short-term funding only. Funding to offset staff time for non-IT personnel directly participating on portal implementation teams, also short-term funding only. Add-on EHR modules and/or other integrated tools focused on patient engagement and wellness, or that enable mobile access to health information. And on-site tools and resources to support enrollment, usage, and patient engagement. We are looking to support the alignment of clinic-level people and processes with portal technology in order to increase usage and achieve patient engagement goals. By people, we mean executive support, employee activation, collaboration, ownership, clearly defined roles and responsibilities, champions and advocates, and patients. And by process, we mean governance, workflow alignment, practice redesign, sustainability, and measurement. Addressing people and process issues are critical when launching a new technology tool. There are several things, however, that the Foundation will not fund as part of this funding opportunity. As previously mentioned, we will not fund actual patient portal software. Again, our focus is more on creating an environment where patients are empowered to act on their health information no matter the delivery platform. We will also not fund electronic health record systems, IT personnel or contractors, general operating or capital projects, or one-off clinic-level external evaluations. As I will discuss in a bit, we will be engaging with an external evaluator to develop and implement an evaluation plan that will include all grantees. Applying for a grant under this funding opportunity involves a 2-step process. Interested organizations must first submit a letter of intent to grantproposals@coloradohealth.org by October 15, 2014. The form and email address are located on the Foundation's website. Prior to submitting a letter of intent, I encourage applicants to contact me with any questions they might have or to discuss whether their project might be a good fit. My email address is dhesse@coloradohealth.org, that's HESSEE, and my direct line is 303-953-3641. This information can be found on the Foundation's website and is also included in a few slides. Selected organizations will then be invited to submit a full proposal and patient portal work plan on either February 15, 2015 or June 15, 2015, depending on clinic readiness. Each organization will receive assistance from the statewide partner on the development of these planning documents. Although funding will not be granted for this planning phase, applicants will benefit from a resource dedicated to assisting them assemble a patient portal work plan, which can help guide work they may already be doing in this space, for example, to meet meaningful use or patient-centered medical home certification requirements, whether or not the implementation phase is funded. Those awarded grants will continue to engage with the statewide partner on the implementation of their work plan. 1-year, non-renewable implementation grants will be awarded through this funding opportunity. The Colorado Health Foundation has always had a strong commitment to evaluation, which we use to help us answer key questions through the systematic collection of data. There are 3 major reasons that we do this. First, we want to improve our planning. We use evidence from both past and current work to help us make decisions about what will be the most effective path moving forward. Second, we seek to improve implementation through the life cycle of the work so that we are learning in real time. And third, we want to understand the extent to which the work we're engaged in is helping to achieve our goals around creating a healthier Colorado. As part of this funding opportunity, grantees will be asked to engage in an evaluation study conducted by an external evaluator. The design and scope of the evaluation will be determined early in the funding opportunity and shared in more detail, but it is anticipated that this study will only require a minimal amount of time from grantees. Grantees may be asked to collect specific quantitative and/or qualitative data about their activities and to participate in some limited data collection with the evaluator. The evaluation will investigate the experience of creating a work plan with the support of a technical assistance group prior to grant submission and implementation. Further, a baseline set of key indicators of portal implementation and effectiveness will be developed and measured. This information will be obtained through interviews and/or surveys at 2 time points, at the beginning and at the end of the grants. Finally, applicants will be asked to indicate how their work will numerically increase the number of Coloradans who are actively engaged in their health, one of the Foundation's new measurable results. Thank you very much for taking time today to learn about this funding opportunity. It was designed to maximize momentum in the current environment around patient portals and to leverage the significant investments that the Foundation has made in IT infrastructure across the state. We are excited about the opportunities to increase patient engagement through patient portals. Again, here is my contact information. Please don't hesitate to reach out with any questions that you have. This concludes our webinar. We will now open it up to any questions, which Beth will moderate.
Thanks, Dara. So just a reminder, if you have a question, feel free to type that in the chat dialog box that's located on the lower left-hand side of your screen. So we'll go ahead and take the first question. It is a safety net dental clinic eligible to apply for this funding?
This is Amy, and I'll be happy to take that question. As Dara mentioned, we are looking to support safety net clinics that provide basic primary care services, and preference will be given to clinics that provide integrated physical and behavioral health services. A safety net dental clinic, a standalone safety net dental clinic, is not eligible for funding through this funding opportunity.
Thanks, Amy. The next question is, what if you have an EHR and patient portal and require add-ons to bring it current? Can the grant cover this on a limited basis?
Thank you for the question. It's a great question. Without knowing the specifics of what those add-ons would look like and what the cost would be, I mean, I think it's something that we could consider, but I would encourage this individual to contact me outside of this webinar to discuss the specifics of what those would look like.
Great. The next question, what is the difference between an add-on module and patient portal software?
Thanks. So we consider the patient portal software to be the actual patient portal. So the module or the software that connects to the EHR or that you turn on through the EHR to be able to serve those patient portal functions. An add-on module would be something that is an addition to this software. So for example, we've seen with some EHRs they have, for example, a wellness module that integrates with patient portal software to increase patient engagement and wellness goals. So that's the type of thing that we're thinking about. It's a good question.
Thanks, Dara. The next question is, could equipment such as tablets for patients to use in our centers be considered on-site tools and resources to support enrollment?
Thanks for the question. Yes, this is something that we would consider as part of this funding opportunity.
And the next question, how many implementation grants do you plan to award in total?
Yeah, so we anticipate awarding approximately 10 implementation grants to safety net clinics. However, the final number may be more or less depending on the scope and amount of each grant. And it should be noted that this represents the total number of grants that would be made over a 2-cycle period, both the February 2015 and the June 2015 cycles.
Okay, and then will the Foundation accept grant proposals after the June 2015 deadline?
Yeah, so at this point, we expect that the funding opportunity will actually close after the June 2015 deadline. However, depending on the results of the evaluation and what we see out there in terms of statewide needs, we may decide to keep it open longer.
What is the average amount you're looking to award to each clinic?
That's a great question. We are looking for grants that would be, I would say roughly between, anywhere from, $25,000 up to $100,000 would be the very maximum amount that we would award for this funding opportunity. Good question.
And then a question about the timeline. What is the process and timeline for selecting the statewide partner?
Yeah, so we plan to post an RFP, a request for proposals, in mid to late September and hope to have the contract executed by the end of November, early December, so that this group can begin supporting the planning activities of selected safety net clinics. Great.
Looks like we have about one more question left. So just a reminder, if you do have a question, please go ahead and type it now in that chat dialog box. So this question is, if a clinic has already implemented a patient portal and patients are using it, is that clinic still eligible for funding?
Yeah, so they would be. Our goal is to ensure that patient portals are being maximized by patients and providers and that the tool is used to increase patient engagement. So if a portal has been launched but that clinic sees that there is support needed to fully integrate it into a practice, then that organization could submit an application for funding.
Terrific. Thanks to Dara and Amy today, and thanks to all of you for participating. Seeing no additional questions, I think that will conclude our question and answer period. Tomorrow, all participants will receive an email with a link to the recording of this webinar, as well as a PDF of this presentation. It looks like we did just get one more question, and we still have a little bit of time left, so we'll go ahead and ask it. That question is, how will this funding opportunity support provider engagement?
I think I understand the question. One of the goals that, as part of the research that we did see the need for a provider buy-in as being a critical component of successfully launching a patient portal, and so we anticipate that aspect would be included in the work plan and also the implementation of that work plan.
Great, thanks, Sarah. So I think, again, that probably concludes the questions and answers. Please don't forget to complete the short survey that will be available on your screen after we end the webinar. We definitely value your feedback. It helps us to improve our future presentations. Thanks again for joining us, and have a great day.